Skeletal system. The study of bone is called osteology. The study of joint is called orthology or syndesmology. Skeletal system is divided into appendicular skeletal and axial skeletal. Appendicular skeletal consists shoulder girdle or upper limb, pelvic girdle or lower limb. Shoulder girdle has clavicle, scapula, humerus, radius, ulna, carpal bones, metacarpal bones, phalanges. Pelvic girdle has pelvic bones, ilium, ischium, pubis, femur, tibia, fibula, patella. Tarsal bone, metatarsal, phalanges. Carpal bones are 18 numbers. The mnemonics to memorize them is she looked too pretty, try to catch her. Whereas Yos scaphoid, Yol lunate, T triquintral, P pisiform, T trapezium, T trapezoid, C capitate, H hamate. Tarsal bone, calcaneum, talus, navicular, cuboid, cuneiform. Axial skeleton, it consists of skull, cranium bone and facial bones. Vertebral column, thoracic edge. Skull consists 22 bones, cranium bones 18 numbers, frontal, parietal, temporal, occipital, sphenoid, ethmoid. Facial bones 14 numbers. They are zygomatic bone, maxillary bone, nasal bone, vomer, lacrimal, palatine, concave, and mandible. Vertebral column has 33 bones, either 26 bone. Cervical vertebral 7 in number, thoracic 12 in number, lumbar 5 in number, sacral 5 in number, and coccyx 4 in number. Thoracic edge, sternum 1 in number, vertebral bone 12 in number, ribs 12 pairs. True ribs are from 1 to 7. False ribs are false ribs but true ribs 8 to 10. Floating but false ribs 11 and 12. Function of bone. It provides the framework to the body. Bone helps to maintain the proper posture of the body. Bone provides the attachment to the muscle and tendons. Bone helps in movement of the body as a whole, part of joints and movement of limbs. Bone forms cavities to protect the organ inside it. Bone contains bone marrow and helps in the formation of blood cells. Bone stores some minerals like calcium and phosphate. Classification of bone. According to the shape and size. Long bone, it has one long shaft and two ends having medullary cavity. Example, femur, humerus, tibia, and fibula. Short bone, carpal, tarsal, phalanges, cuboid, cuneiform. Irregular bones, bones of the face, vertebral bones, hip bone, flat bones, skull bones, scapula, ribs, sternum, sesamoid bone, patella. Bone marrow is absent in patella. Pneumatic bone, maxilla, ethmoid. According to the microscopical classification, compact bone and spongy bone. Compact bone is also called hard bone. Spongy bone is also called cancellous bone. Compact bone is hard and dense, found in flat bone and shaft of long bone. It is made up of unit of cell called osteon and Haversian canal. Haversian system is made by central canal. Haversian canal surrounded by series of expanding concentric ring called lamina. Haversian canal. It carries blood vessel, lymph vessel, and nerve to the living bone cell called osteocyte. Each Haversian canal is connected to neighboring canal by tunnel at right angle to them called perforating canals. Lamina. These are the string of cavities in the between lacunae and adjacent osteons. Osteons lies in the cavity and communicate with each other by thin channels called canaliculi. Spongy bones. It looks like honeycomb. Framework of trabecula, which consists of few lamina and osteocytes connected by canaliculi. Microscopic structure of bone. Bone is a rigid form of connective tissue. Forms most of the supporting tissue of the body. Bone is composed by organic matter 65%, mainly calcium and phosphate, and inorganic matter 35%, osteoid and collagen. Bone cells are of three types. Osteoblast, bone forming cells that secrete collagen and other constituents of bone, usually present in deeper layer of the periosteum, outer covering of the bone. Osteocyte, bone developed osteoblasts are trapped within new bone cell. In this stage, osteoblast is called osteocyte. It monitor and maintain the tissue. Osteoclast. Osteoclast reabsorbs the bone to maintain a normal shape of the bone. It takes place on the surface of bone. General structure of long bone. Long bone consists of one long shaft, two ends, and medullary cavity. Ends are called epiphyses. The middle that is growth plate is called metaphysis. The hard part shaft diaphysis. Periosteum end is called epiphysis, and the nutritional artery in the middle shaft diaphysis composed by the compact bone contains centrally medullary cavity which contain red marrow and yellow marrow. Epiphysis ends. It is composed by outer covering of compact bone and inner layer of cancellous or spongy bone. There is epiphyseal cartilage which separate epiphysis and diaphysis, also called metaphysis. They ossified when bone growth is completed. Periosteum, vascular membranous covering of long bone. It covers bone except joint cavity. Joint cavity are lined by hyaline cartilage. There are two layers. Outer layer which consists of tough fibrous and covers the bone. Inner layer it contains bone cell. Clavicle. Clavicle is the first bone to ossify. Clavicle is long bone and only lying horizontally. The bone has cylindrical shaft and two ends, medial and lateral. The medial end articulate with manubrium of the sternum and form sternoclavicular joint. The lateral end articulate with acromion process of scapula and form acromioclavicular joint. Scapula. The scapula is a triangular flat bone. This is lying on the posterior aspect of thorax. It extends from second to the seventh rib. The scapula has two surfaces, costal and the dorsal surface, three borders, superior, medial, lateral, and three angles, superior, inferior, and lateral angles. Sternum. Sternum is an elongated flat bone forming the anterior part of the thoracic cavity. It is about 12 to 15 cm long and consists of three parts: manubrium, body, and xiphoid process. Manubrium is the uppermost part and thicker part. Superior to this, supraesternal notch is present. On each side of the manubrium, there is an oval articular space which articulate with the medial part of the clavicle to form sternoclavicular joint. Manubrium makes slight elevation when joined with the body called angles of Lewis. It is important clinically to count the ribs. Humerus. Humerus is the longest bone in the upper limb. It has upper end, lower end, and the shaft. The upper end consists of head, neck, and lesser and greater tubercle. There are two rough projections, that is tubercle, a separation line between head and tubercle called anatomical neck, and the line separating upper end and shaft is called surgical neck. There is a projection over the lateral side of the shaft of humerus called deltoid tuberosity of the shaft humerus called deltoid tuberosity, which helps in the insertion of deltoid muscle. Radius and ulna. Radius is the lateral bone of the forearm. The proximal end of the radius has a disc separate head which articulate with the capitulum of humerus at elbow joint. The lower end is widest part of the bone which form the radio-ulnar joint distal. The inferior end of the distal radius is smooth and concave where it articulates with carpal bone at the wrist joint. The ulna. Ulna is the larger bone of the forearm, lies in the medial side of the forearm. It has also upper end, shaft, and lower ends. Its upper ends articulate with the humerus and form elbow joint. The shaft of the ulna is thicker proximally. Carpal bone and wrist bone. There are 8 in numbers arranged in 2 rows, proximal row and distal row. Scaphoid, linear, tracheventral, pisiform, hamate, capitate, trapezium, and trapezoid. Femur. Femur is the longest, strongest, and the heaviest bone of the body. Femur also consists of the body shaft and two ends. The proximal end consists of head, neck, greater and lesser trochanter. Distal ends bordered by medial and lateral condyle. Head of the femur is almost spherical and smooth. It articulates with the acetabulum of hip bone to form hip joint. The shaft is more likely cylindrical. It is narrowest at the middle and more expanded inferiorly than superiorly. The lower end of the femur is widely expanded to form two large condyles, one medial and one lateral condyle. They articulate with tibia to form knee joint. Joints is the junction between two or more bones or cartilage. It is the device which permit movement. The study of joint is called orthology. The bone of joints are curved and surrounded by connective tissue that hold bones together and determine the type and degree of possible movements. Classification of joints: fibrous joint, cartilaginous joint, synovial joint. Fibrous joint: the bones are joined by fibrous tissue. Joints are either immovable or permits slight degree of movements. They are grouped as sutural fibrous joint. It is found in cranium bones. Syndesmosis fibrous joint. Radioulnar joint formed by interosseous membrane. Gamophysis, the joint between mandible and teeth. Cartilaginous joint. The bones are united by cartilage or combination of cartilage and fibrous tissue. They are of two types: primary cartilaginous joint and secondary cartilaginous joint. Synovial joint, the most important joint, means freely movable joint. Synovial joint. In synovial joint, bones are united by cartilage with a synovial membrane enclosed joint cavity. The movements possible in synovial joints are flexion, extension, abduction, abduction, circumduction, rotation, supination, pronation. The synovial joints are classified as ball and socket joint. Example: shoulder joint and hip joint. Hinge joint, knee joint and elbow joint. Gliding joint, wrist with carpal bone. Pivot joint, joint between atlas and axis. Condyloid joints, the joint between metacarpal and metatarsal. Sliding joints, joint of thumb and metacarpal.